What is hypertension? By definition, 140/90 consistently. So somebody who's constantly over 140/90 while at rest. If you've ever done any sort of like stress exam, like putting the 12 lead on and running on a treadmill, they'll also check your blood pressure and they want to see how high your blood pressure goes under stress. Now, your at stress blood pressure versus your at rest blood pressure should be way different. If your at rest blood pressure is over 140/90, you're clinically hypertensive. Most cases result from advanced atherosclerosis or arteriosclerosis, right? When we actually have a plaque buildup inside of the arteries. Having hypertension or prolonged hypertension puts you at a greater risk for strokes, heart attack, heart failure, and even kidney failure. So a lot of problems that we see, obviously, in EMS, a lot of problems that could have probably reduced for that patient, or the patient could have fixed earlier on in their life if they would have realized that they had the hypertension and possibly treated it early. Again, some people with hypertension, it's just the roll of the dice. There's some people that are really good health and they just have hypertension because it's just in their genetics. Some people, it's based on the foods and the lifestyle that they have. For a lot of people, it's easily treated. There's a lot of medications out there. Statins, pills, beta blockers, a lot of different ways to treat hypertension are often seen. Now, with regards to hypertension, because the first thing that a lot of people want to think about when they hear hypertension is, hey, dude, are we treating it or not? Okay, are we treating it or not? Now, once you get hired somewhere, you'll probably have some sort of hypertensive emergency protocol that you're going to be following. And if we have somebody that has blood pressure greater than 140/90, it's not a problem. A lot of adults, and especially in the elderly, have over 140/90 all the time. It's not a problem. What becomes a problem if it gets too high, and the patient starts to have symptoms. So let's take a look at this. This is called hypertensive encephalopathy, or an acute hypertensive crisis. To have an acute hypertensive crisis, one's blood pressure must exceed 200/130. This is straight out of the textbook. This is part of the national. Okay, 200/130 is considered a hypertensive crisis. Any mean arterial pressure that exceeds 150, fluid will leak through the blood-brain barrier, causing ICP with a MAP greater than 150. So you can already see the problems what hypertension could cause. If somebody has hypertension and they're having a hypertensive crisis, we now will step in as EMS to lower blood pressures. Can anyone give me a medication that comes to mind that you would utilize to treat a blood pressure? Interesting that nitroglycerin does get brought up, because nitroglycerin is a vasodilator. Now, what's interesting is like your body has something called baroreceptors. Baroreceptors are located throughout your body circulatory system, and what it checks for is barometric pressures. So when it finds that your pressure is really high, what it does is it causes vasodilation. So typically when you see somebody who has a high blood pressure, what do you notice about their face? Have you ever seen somebody who has like really red skin or flushed skin? They have hypertension. Well, what's happening is, their body realizes, hey, dude, we got high blood pressure. Let's go ahead and fix it. So your body's compensatory mechanism is to dilate blood vessels and try to lower down the blood pressure. So with that being said, typically, vasodilators are not used to lower down blood pressures when somebody has hypertension. That's typically not like... Can you use vasodilators to lower blood pressures? Of course. A lot of it always comes down to how is the person's body basically reacting to this high blood pressure, or how is this person's high blood pressure being treated? For the most part, we need to kind of lower the amount of work that the heart's doing. Labetalol, which is a beta blocker, we know it's a beta blocker because of olol, right? The suffix, an ACE inhibitor like lisinopril. Prils and beta blockers are often used to treat hypertension. Good medications, because what they do to the heart is kind of reduce the amount of strength that these hearts are actually contracting. And by reducing the heart's workload, it lowers the blood pressure.